Table 91-47 is something you're probably all familiar with, a patient information form. See page 351 and the instructions that you will notice here on the right, which I have posted in Blackboard for you. Our first step is to insert a boxed table with 1 column and 15 rows. Go to the Insert tab, insert Table, 1 column, type in 15 rows, say OK. We are going to split cells as shown to provide room for individual entries and type the information that is shown in your textbook. So I think I will type as we go and split the cells as we go so that we won't lose our place in the confusion. Your book indicates that you are to insert a blank line before typing the first header, patient information. If you try to do it from this point, this is what's going to happen. You're outside of the table. So instead, do a soft return, which means hold down Shift while you hit Enter, and then you can proceed to turn on Caps Lock, Bold, and Center, Control E, to type patient information, and then enter once for a blank line after. Tab to the next line and hit Enter 1 time. Type date, turn off Caps Lock, tab to the next line, and we're going to split the cells in this row. So right-click, select Split Cells. We want 2 columns and 1 row. Click OK. And then get this symbol in order to drag it over to appear as it is in the book. Actually, it's aligned about under the N in patient information, so we'll leave it there. We can tell that the next row is to be the same, so let's do that one now before we type. Split cells, the same situation, and then drag it over to match. In the next row, we need 3 columns. So when we right-click and split cells, we're going to increase the number to 3. OK. We'll line up the second one with those just above, and the others should be spaced just fine. OK, let's go ahead and then fill in the information here. Right, and now we're ready for the next header. I'm going to hit Enter once, turn on Bold, Center, and Caps Lock. Hit Enter once, then tab to the next row. Turn off Caps Lock, and then in the next row, we're going to split the cells again. The next row is going to be split with 3 columns. Then we're ready for another header row. So Caps Lock, Bold, Center, if we're going to split this row, this one should remain evenly split, however. Phone and policy number. And the same is true of this row. We're going to split it and leave it aligned just as the one above it. Okay, now let's apply the other formatting that this table requires in rows 1, 7, and 11. I'm going to select the first row, hold down Control, and then select 7 and 11. Then we can apply bold to all three at once. Now the headings are to be typed in 14-point Cambria. So we're going to switch those at this time. We're going to go to the font and choose Cambria and then change them all to size 14. Okay, we have inserted our blank lines above the information in rows 2 to 6, 8 to 10, and 12 to 15. The next thing we're going to do is apply a 25% shading to rows 1, 7, 11, and 15. So I'm going to select all of those rows by holding down the Control key as I click over in the left margin. Then we go to our Table Tools Design tab, the shading command, and come down until your tooltip shows that you're on the 25% shading. Okay. Now, we could center the table horizontally and vertically. However, if we space it as indicated in the class session notes that follow, that's not going to be necessary because we want to use the whole page to give people plenty of room to fill out the information here. I think that we can adjust our row heights best by inserting an extra blank line in each cell. Or each row. Okay, now the one problem that we have is that we've gone on to a second page and it is blank. And we're so close to it being very right. I think that you'll find all you have to do is drag the margin down just a little bit and it pops back to one page. So that's what I would suggest here. You could also manually adjust your row heights, but then they're not all going to be the same, and this is the most uniform way of doing it. Let's turn off show height so you can get a look at your form. In its printable form. As a reminder, this doesn't need to fit on one page. So if it goes onto the second page, delete those extra lines or make adjustments so that it will fit on one. Okay, you are ready to proofread, return to GDP, correct your errors to 0.